Hi, this is Greg Michaud for afibprofessional.org, Cardiosource Clinical Community. I have with me today Sam Goldhaber to talk to us about Apixiban, which was just recently released by the FDA. Sam, what's going on with Apixiban?
Well, Apixiban is the third of the novel oral anticoagulants to be FDA approved for stroke prevention in atrial fibrillation. It's an activated 10A antagonist, so it works pretty high up in the coagulation cascade, and it's had a remarkably great track record in landmark clinical trials, both for efficacy of stroke prevention and for safety with reduction in bleeding. There are probably three major trials that the cardiologic clinical community should be familiar with regarding Apixiban. The first one is the Averroes trial, where Apixiban faced off against baby aspirin for stroke prevention, and Apixiban did such a great job in preventing stroke that it was considered unethical to continue the trial. So after about 5,000 patients, the trial was stopped because it was so heavily in favor of the Apixiban group. Now, the safety in that same trial in terms of bleeding, Apixiban had no more bleeding complications than a baby aspirin. The second big trial, and this is the one upon which the FDA approved Apixiban for stroke prevention in AF, is the Aristotle trial, where Apixiban went head-to-head against warfarin. In that trial, Apixiban really hit a grand slam home run with fewer strokes than warfarin, fewer major bleeds than warfarin, and a reduction in all-cause mortality. And that's what really led to the FDA approval. The third study was published in 2013 in the New England Journal of Medicine. It has nothing whatsoever to do with atrial fibrillation. It's the Amplify extension trial with Apixiban, and there patients who had suffered pulmonary embolism or DVT and had been treated with anticoagulation for 6 to 12 months were then randomized to Apixiban or placebo. Now, Apixiban reduced recurrent venous thromboembolism by about 80%. But the safety record and the lack of bleeding was incredible. In fact, in the Apixiban group, there was less major bleeding than in the placebo group. And when factored in major bleeding and clinically important non-major bleeding, Apixiban in the lower dose that was used had no more major bleeding than placebo. So this is a very exciting addition to our armamentarium.
Briefly, Sam, are there precautions we should consider when prescribing this new drug, and what side effects limit its use?
Well, it's an anticoagulant, so we have to still be careful about bleeding. And there are two doses. The lower dose is the one to be used for patients who are 80 years of age or older, who are frail, who have a reduction in their renal function.
Well, thanks, Sam, for giving us an update on Apixiban.